In the dark alleys of Victorian England, one woman dared to illuminate the path of compassion and care. Florence Nightingale, known as the Lady with the Lamp, transformed nursing into a respected profession. But what drove her to become a beacon of hope during the direst of times? Born in 1820 to a wealthy British family, Florence Nightingale exhibited her interest in nursing from a young age, despite societal norms. Her parents opposed her ambitions, believing that a woman of her stature should pursue marriage instead. Yet, Florence's resolve to help the sick only grew stronger. In 1851, Nightingale defied her family's expectations and trained as a nurse in Germany. The experience solidified her belief in the importance of proper sanitation and care. She diligently studied the practices that would later revolutionize nursing and hospital conditions. As the Crimean War erupted in 1854, Florence seized the opportunity to make a difference. She assembled a team of nurses and traveled to the battlefront, where she confronted unsanitary conditions and rampant disease. Her mission was to bring care to the wounded and dying. Upon arriving in Scutari, Nightingale was horrified by the living conditions. The hospital was overcrowded, filthy, and lacked basic resources. She took immediate action, implementing sanitation practices and optimizing the use of space for the patients. Nightingale worked tirelessly, often making rounds at night with her lamp, earning her the nickname, the Lady with the Lamp. Her compassion and dedication offered solace to the patients, who began to see her as a guardian angel in their darkest hours. Through her relentless efforts, the death rate in the Scutari hospital dropped dramatically. Nightingale's thorough documentation of the conditions and outcomes laid the foundation for modern nursing practices and healthcare reforms. In 1856, after the war ended, Nightingale returned home as a national hero. Her work had not only saved lives but also reshaped the public perception of nursing as a vital profession. She published her findings advocating for nursing education and healthcare reform. In 1860, Florence founded the Nightingale School of Nursing at St. Thomas's Hospital in London, establishing the first professional nursing school. Her curriculum emphasized hygiene, patient care, and the importance of a nurse's role in healthcare. Nightingale's principles of nursing became the gold standard, influencing nursing practices worldwide. Her relentless advocacy for proper sanitation and reform in healthcare systems marked a significant shift in medical practices across continents. Despite her fame, Nightingale remained humble, often advocating for the needs of the poor and marginalized. She worked tirelessly to improve healthcare access for all, regardless of social status, emphasizing that compassion should be at the core of medicine. In 1883, Nightingale was awarded the Royal Red Cross by Queen Victoria for her contributions to nursing. This recognition further solidified her legacy, highlighting the importance of women in healthcare and leadership roles. Florence Nightingale continued to write and advocate for healthcare reforms until her death in 1910. Her writings remain a cornerstone for nursing education and medical ethics, influencing countless generations of healthcare professionals. Florence Nightingale's legacy lives on, inspiring countless individuals to pursue careers in nursing and healthcare. Her unwavering commitment to compassion and care has revolutionized the profession, reminding us that at the heart of medicine lies human dignity and empathy. As we reflect on her life, let us carry forward Florence's legacy by embracing compassion in our own lives and recognizing the profound impact one individual can make in the world of health and humanity. In the wake of the Crimean War, Florence Nightingale emerged as a beacon of hope, addressing the dire conditions faced by soldiers. Her experiences in the war fueled her resolve to improve medical care standards, transforming hospitals into places of healing. Nightingale's meticulous observations laid the groundwork for revolutionary healthcare reforms that would ripple across the globe. Nightingale's famous Notes on Nursing, published in 1859, served as a foundational text for nursing education. This groundbreaking book emphasized the importance of hygiene, proper nutrition, and compassionate care for patients. As a result, it not only educated nurses, but also shaped public perception of the nursing profession as a vital part of healthcare. With the establishment of the Nightingale Training School for Nurses in 1860, Florence took her mission further. This institution focused not only on practical skills, but also on instilling a sense of moral duty in its students. Her vision transformed nursing from a menial job into a respected profession for women. Florence's pioneering efforts caught the attention of government officials, leading to significant healthcare reforms in military and civilian hospitals alike. She advocated for better sanitation practices, resulting in reduced infection rates. Her evidence-based approach became a model for public health policies worldwide. Florence Nightingale's influence extended beyond nursing. She became an early advocate for statistical data in healthcare. Her use of statistics to present the impact of sanitary conditions on soldier mortality was groundbreaking. This led to the establishment of more rigorous data collection methods in hospitals and healthcare. In 1863, Nightingale founded the Nightingale Fund, which provided financial support for training nurses. This initiative not only empowered women, but also ensured that quality care was accessible to the most vulnerable populations. Florence believed that every individual deserved compassionate care, regardless of their background. Despite her achievements, Nightingale faced considerable challenges, including opposition from established medical professionals. Her insistence on reforming entrenched practices often put her at odds with traditionalists. Yet, her unwavering dedication to improving healthcare led to enduring change. As a pioneer in nursing, Nightingale also emphasized the importance of continuing education for nurses. She believed that lifelong learning was essential to adapting to evolving healthcare needs. Her vision laid the groundwork for the ongoing professional development seen in nursing today. Florence Nightingale's legacy extends to global health initiatives. Her principles continue to influence nursing practices and healthcare policies around the world. As nations grapple with health crises, her compassionate approach serves as a guiding light, reminding us of the humanity within medicine. Nightingale's impact wasn't limited to healthcare alone. She was also an advocate for social reform. Her writings touched on issues such as women's rights and education, cementing her role as a leader in advocating for social justice. Her voice resonated with the struggles of her time, making her a timeless figure. Throughout her life, Florence Nightingale maintained an extensive correspondence, sharing her insights and experiences with others. These letters allowed her to influence a broader audience and foster connections with like-minded individuals. Her words inspired countless others to follow her path in nursing and beyond. Despite her declining health later in life, Nightingale continued to advocate for healthcare reforms from the confines of her home. Her ability to influence policy without public appearances underscores her tenacity and the respect she commanded among her peers. This dedication exemplified her unwavering commitment to her cause. In 1907, Florence Nightingale became the first woman to receive the Order of Merit, a testament to her unparalleled contributions to nursing and healthcare. This prestigious recognition highlighted her impact on society and served as an inspiration for future generations of healthcare professionals, especially women. As we delve into Florence Nightingale's life, we uncover a legacy marked by resilience, compassion, and groundbreaking reform. Each step she took set the stage for the modern nursing profession, proving that one woman's vision can transform an entire field and inspire millions. Now, as we reflect on her monumental achievements, we see how Florence Nightingale's principles remain relevant in today's ever-evolving healthcare landscape. Her insights on patient care, data collection, and sanitation continue to shape the way we approach health and healing in the modern world. Nightingale's life also serves as a reminder of the importance of compassion in healthcare. Amidst the technological advancements, her emphasis on the human aspect of care is as crucial as ever. The lessons she imparted inspire not only nurses, but all individuals involved in caring for others. Her legacy has transcended borders, reaching healthcare systems around the world. Nightingale's principles have been integrated into nursing curricula internationally, ensuring her vision continues to shape the future of healthcare globally. This underscores the universal truth that kindness and care knows no boundaries. Florence Nightingale's story is a powerful testament to the impact one individual can have on the world. Her unwavering dedication, innovative spirit, and compassionate heart have paved the way for generations of nurses and healthcare professionals to follow in her footsteps. Her influence reminds us all of the power of a single voice advocating for change. Even in the present day, Florence Nightingale's contributions are celebrated each year on International Nurses' Day, observed on her birthday, May 12th. This day not only honors her legacy, but also recognizes the vital role nurses play in society. It serves as a reminder of the compassion and dedication that nurses embody in their daily lives. Through Nightingale's legacy, we learn that the essence of healthcare lies in treating the whole person, not just their ailments. Her holistic approach to nursing continues to inspire modern practices that prioritize patient-centered care and emotional support, highlighting the importance of empathy in healing. Moreover, Nightingale's advocacy for women's education and empowerment remains relevant today. Her example encourages women to pursue careers in healthcare and leadership roles, breaking barriers that once restricted them. Her life is a call to action for ongoing change in gender equality and representation across all fields. Florence Nightingale's influence extends into the realm of mental health, where her recognition of the psychological aspects of healing has become increasingly important. Her understanding that mental well-being is integral to overall health encourages a more comprehensive approach in today's healthcare systems. Her remarkable story has inspired countless biographies, documentaries, and even novels, ensuring that her life and mission continue to be shared with future generations. These narratives serve not only to honor her legacy, but also to educate and inspire those who seek to follow in her footsteps. As we continue to learn from Florence Nightingale's life, it is essential to recognize the values she championed: compassion, integrity, and dedication. These tenets remain vital in shaping the future of healthcare, guiding professionals in their commitment to serve with love and respect for their patients. Ultimately, Florence Nightingale's legacy endures not only through the systems she transformed, but in the hearts of those she touched with her compassion. Each nurse and caregiver who embodies her values contributes to a collective legacy of care that transcends time and place, fostering a better world for all. Florence Nightingale remains a symbol of hope and change in the healthcare profession. Her life's work continues to inspire ongoing dialogue about the importance of care, compassion, and the need for reform in healthcare systems worldwide. Her story is a reminder that the spirit of service can change lives. As we look toward the future, Florence Nightingale's teachings guide us in addressing today's healthcare challenges. By upholding her values and adapting her principles for the modern era, we can continue to promote health equity, compassion, and professionalism in nursing and beyond. In an age where healthcare is rapidly evolving, the call for compassion in care is more important than ever. Nightingale's insights remind us that every patient deserves to be treated with dignity and respect. As we carry her torch forward, let us ensure that her values guide our actions in the healthcare field. Florence Nightingale's story is not merely a historical account. It is a living legacy that continues to inspire those who pursue careers in healthcare. Her life teaches us that with dedication, compassion, and a commitment to reform, we can all be agents of change in our communities and beyond. As we conclude our exploration of Florence Nightingale's incredible journey, we reflect on the unwavering principles she embodied. Her legacy is a testament to the power of one person to change the course of history, encouraging us all to embrace compassion and pursue positive change in our own lives. In the years following her return from the Crimean War, Nightingale became a prolific writer, publishing over 200 books, reports, and pamphlets. Her writings not only documented her experiences, but also set the foundation for modern nursing practices, advocating for sanitation and proper medical protocols. Nightingale's evidence-based approach to healthcare began to reshape the profession, emphasizing the need for skilled nursing. Florence's tireless efforts culminated in the establishment of the Nightingale Training School for Nurses at St. Thomas's Hospital in London in 1860. This innovative institution provided formal nursing education, emphasizing practical training and the importance of hygiene. It marked a turning point as nursing began to be recognized as a respectable and essential profession. The impact of her training school was profound. Within a few years, Nightingale's model of nursing education spread across the globe, inspiring similar institutions in other countries. Many of her students went on to become leaders in nursing, spreading her philosophies and practices far and wide. Florence's visionary work laid the groundwork for the nursing profession as we know it today. Despite her success, Nightingale faced fierce opposition from traditionalists within the medical community. They resisted her calls for reform, often dismissing her as an amateur. However, her persistence and the undeniable evidence of improved patient outcomes made it harder for them to ignore her contributions. With each report, she gained credibility and respect. As the years progressed, Nightingale's work extended beyond nursing education. She began to focus on public health reform, advocating for better sanitation and living conditions in hospitals and communities. Florence understood that health was not merely the absence of disease, but a holistic state affected by environmental factors. Her advocacy led to significant reforms in military and civilian health systems. In 1861, she was commissioned to improve the health of the British Army, resulting in the establishment of better hygiene practices and living conditions for soldiers. Nightingale's impact was felt not only in nursing, but also in how health systems operated at large. In 1863, Florence Nightingale became the first woman to be awarded the Royal Red Cross for her outstanding contributions to nursing. This recognition not only honored her efforts, but also highlighted the importance of nursing as a profession. She utilized this platform to further promote her vision for compassionate care and professional standards in healthcare. Nightingale's influence reached beyond borders, as she played a crucial role in establishing the International Red Cross. Her ideas about nursing during wartime and emergency care were crucial in shaping humanitarian services worldwide. This connection to global healthcare initiatives further solidified her legacy as a pioneer. As she aged, Nightingale's health began to decline, yet her commitment to nursing and healthcare reform did not waver. Even while bedridden, she continued to advocate for reforms through her writings and correspondence. This relentless spirit exemplified her dedication to the nursing profession and her unyielding desire to improve healthcare. In 1907, Nightingale was honored with the Order of Merit, becoming the first woman to receive this prestigious award. This recognition not only marked her achievements, but also paved the way for women in leadership roles in medicine and beyond, inspiring generations to break through barriers and excel in their fields. Throughout her life, Florence Nightingale was a champion of statistical analysis in healthcare. Her innovative use of data visualization, particularly through the polar area diagram, helped illustrate the impact of poor sanitation on soldier mortality rates. This approach revolutionized how data was utilized in medicine, emphasizing the power of evidence in driving change. Nightingale's legacy extends into contemporary nursing practices, where her principles of hygiene, patient care, and compassionate treatment remain integral to nursing education. Many modern nursing programs continue to incorporate her philosophies, ensuring that future generations of nurses carry her torch forward. In recognition of her lifetime of service and impact, the International Nurses Day is celebrated on her birthday, May 12th. This day not only honors Nightingale's contributions, but serves as a reminder of the vital role nurses play in healthcare systems worldwide, reinforcing the importance of compassion and service in nursing. Florence Nightingale's unwavering dedication to nursing has inspired countless biographies, documentaries, and films. Her life story continues to resonate, illustrating the power of one individual to affect change. Florence's commitment to care and reform endures, reminding us that compassion is essential in healthcare. As we explore the ongoing influence of Florence Nightingale, it becomes clear that her legacy is woven into the fabric of modern healthcare. From nursing education to public health policy, her vision continues to shape practices and inspire new generations of healthcare professionals. Nightingale's focus on patient-centered care resonates strongly in today's healthcare discussions. Her belief that understanding the patient's environment and emotional well-being is crucial contributes to holistic care approaches that are prevalent in modern medicine. The Nightingale Pledge, taken by nursing graduates, reflects her legacy of ethical standards and commitment to patient care. This oath symbolizes the enduring influence of her principles, ensuring that every nurse embodies the values she championed throughout her life. As we delve deeper into Florence Nightingale's impact, we recognize her role in advocating for health equity. Her belief in providing care regardless of social class or background laid the groundwork for the push toward more inclusive healthcare systems that prioritize accessibility for all. Nightingale's writings also emphasized the importance of continuing education for nurses. She believed that lifelong learning was essential for the growth of the profession and the enhancement of patient care, which is a principle that remains relevant today in nursing curriculums. Moreover, Nightingale was instrumental in influencing healthcare policies that aimed to improve nursing conditions and patient outcomes. Her advocacy for environmental reforms in hospitals has led to the implementation of regulations that safeguard patient well-being and enhance the quality of care. The statistics and reports published by Nightingale often highlighted the disparities in healthcare access and quality. Her relentless pursuit of truth through data driven her mission to ensure that every individual received the care they deserved, regardless of their circumstances. Nightingale's legacy is not just confined to historical textbooks. It is alive in the hearts of nurses and healthcare professionals around the world. Her spirit of compassion and reform continues to inspire those who enter the field, driving them to advocate for their patients and communities. Florence Nightingale also influenced the nursing profession's approach to infection control and prevention. Her emphasis on cleanliness and sanitation in healthcare settings set a precedent that paved the way for evidence-based practices that are critical in modern medicine, especially in light of recent global health crises. The principles established by Nightingale resonate deeply within the healthcare community today. As contemporary challenges arise, her teachings serve as a guiding light, reminding healthcare professionals of the importance of empathy, research, and the need for systemic change. Through her tireless advocacy and innovative spirit, Nightingale paved the way for future advancements in nursing. Her commitment to improving healthcare outcomes has inspired countless initiatives aimed at enhancing nursing practices and patient safety across the globe. As we look toward the future, Florence Nightingale's life and work continue to challenge us to strive for excellence in nursing. Her dedication to care and justice reinforces the idea that compassion is at the core of all healthcare practices, driving us to create a better world for those in need. The enduring impact of Florence Nightingale emphasizes the importance of mentorship in nursing. Her role as a mentor to countless nurses highlights the responsibility of experienced professionals to guide and inspire the next generation, ensuring the values of compassion and excellence are passed down. Furthermore, Nightingale's influence can be seen in the establishment of nursing organizations and associations that advocate for nurses' rights and professional development. Her vision for a united nursing community has fostered collaboration and support among healthcare workers, promoting a collective voice in the profession. Florence Nightingale's legacy is also honored through various memorials and institutions named after her. These sites serve as reminders of her contributions to healthcare and continue to inspire future generations to pursue careers in nursing and health professions. In the modern era, Florence Nightingale's principles have become integral to the quality improvement movements in healthcare. Her emphasis on data-driven decision-making is echoed in contemporary initiatives aimed at enhancing patient care and safety, ensuring her influence remains relevant in today's healthcare landscape. Nightingale's work has also inspired global health initiatives that address public health challenges and promote wellness worldwide. Her vision of healthcare equity resonates strongly today, as we strive for systems that provide everyone access to essential health services. As we further explore her legacy, it remains evident that Florence Nightingale's vision was far ahead of her time. Her ability to blend compassion with scientific rigor set a precedent for future healthcare professionals, encouraging them to approach their work with both empathy and critical thinking. Nightingale's influence has also expanded into nursing research, with many studies focusing on the impact of nursing care on patient outcomes. Her legacy inspires ongoing research efforts that seek to improve practices, demonstrating that evidence-based care is essential for effective healthcare delivery. The principles that Nightingale championed are echoed in modern healthcare discussions, particularly regarding mental health and well-being. Her holistic view of patient care laid the groundwork for addressing not just physical, but also emotional and psychological needs in healthcare. As we reflect on Florence Nightingale's life, we see how her dedication to improving healthcare has inspired countless individuals to pursue careers in nursing and medicine. Her legacy encourages us to seek opportunities to serve others, emphasizing that healthcare is a calling that requires compassion and commitment. The ongoing relevance of Nightingale's teachings in today's nursing education underscores her foresight. Her belief in the importance of adaptability and resilience in healthcare professionals is mirrored in current training programs that prepare nurses to face evolving challenges in the medical field. In addition to her accomplishments in nursing, Nightingale played a role in advancing women's rights and opportunities in the 19th century. By establishing a career in a male-dominated field, she opened doors for future generations of women to pursue careers in medicine and leadership. Florence Nightingale's courage in challenging societal norms and advocating for nursing as a profession laid the foundation for the increased respect and recognition that nurses receive today. Her legacy serves as a reminder that positive change often requires resilience and a passionate commitment to one's beliefs. In recognizing the importance of collaboration in healthcare, Nightingale's legacy encourages a team-based approach. Her models of nursing emphasized working together for the best patient outcomes, a philosophy that rings true in modern healthcare practices today. Nightingale's profound influence has also inspired various awards and recognitions for outstanding nurses in her honor. These accolades serve not only to celebrate excellence in nursing, but also to remind practitioners of the compassionate ideals she embodied. As we engage with the stories of nurses today, we often find echoes of Nightingale's philosophy in their dedication and commitment to care. The nurturing spirit she represented lives on in nursing practices, guiding healthcare professionals to approach their work with love and devotion. The global pandemic further underscored the significance of nursing, highlighting the very principles Nightingale championed over a century ago. Nurses around the world rose to the occasion, embodying resilience, compassion, and the commitment to patient care during a time of unprecedented challenge. As society continues to evolve, the lessons learned from Nightingale's life remind us of the importance of adapting to new challenges in healthcare. Her ability to innovate and advocate for change serves as a beacon for healthcare professionals navigating the complexities of modern medicine. Ultimately, Florence Nightingale's story is a powerful reminder of the impact that one individual can have on the world. Her legacy, rooted in compassion, innovation, and tireless advocacy, continues to inspire individuals in healthcare and beyond to strive for excellence and make a difference in the lives of others. As we continue to honor Florence Nightingale's contributions, let us carry her spirit forward into our own lives. By embracing her values of compassion, dedication, and reform, we can all contribute to creating a healthier, more equitable world for everyone. As hospitals evolved, Nightingale's principles became foundational to nursing education. Her insistence on training and standards transformed nursing from a mere vocation into a respected profession. This shift not only empowered women, but also improved patient care significantly. The Nightingale Pledge, introduced in 1893, was a defining moment for nursing graduates, emphasizing ethical practice and the commitment to patient welfare. This pledge echoed her values, ensuring that future nurses carry her legacy forward. Nightingale's data-driven approach to healthcare laid the groundwork for modern nursing statistics and public health policies. Her pioneering use of statistical analysis in the Crimean War demonstrated the importance of hygiene in saving lives and reducing mortality rates. Her influence extended beyond nursing. Nightingale's advocacy for sanitary reforms changed hospital designs worldwide. The incorporation of better ventilation, sanitation, and layout became standards, revolutionizing patient care environments. In her later years, Nightingale continued her advocacy through writing and correspondence, sharing her insights on healthcare reform globally. She authored over 200 books and reports, establishing herself as an influential voice in public health. Nightingale's tireless efforts earned her accolades and recognition, even from Queen Victoria, who sought her expertise in improving military hospitals. Such validation highlighted the respect she garnered for her contributions to healthcare. The establishment of the Royal College of Nursing in 1916 was a pivotal moment, with Nightingale's legacy guiding its creation. This institution aimed to uphold the standards she championed, ensuring that her vision for nursing continued. Nightingale's work inspired generations of nurses, including those in wartime and crisis situations. Her emphasis on compassion and care transformed how society viewed the role of a nurse, making it heroic and essential. Today, Florence Nightingale is celebrated each year on International Nurses' Day, a testament to her enduring legacy. Her birthday is a reminder to honor the contributions of nurses worldwide and recognize their impact on society. Nightingale's impact extends into modern healthcare practices, where her principles of evidence-based care and patient-centered approaches are now standard. Her vision continues to guide healthcare professionals in their pursuit of excellence. As we reflect on Florence Nightingale's life, her unwavering commitment to nursing and public health remains a beacon of inspiration. She showed that one individual's dedication can change the course of history and improve lives globally. In a world still facing healthcare challenges, Nightingale's principles remind us of the importance of compassion, advocacy, and reform. Her legacy encourages individuals to stand up for those in need and strive for a better future. Florence Nightingale's legacy is not just a chapter in history, it is a guiding light for future generations. As we carry her spirit forward, let us all strive to make a difference in the lives of others, just as she did. Her story inspires us to embrace compassion and excellence in our everyday lives. In honoring her contributions, we find the motivation to continue her work, creating a healthier, more compassionate world. As we conclude this journey through Florence Nightingale's life, let us remember that her spirit lives on, urging us to uplift one another. In her name, may we always choose kindness and strive for a better tomorrow.